Hello, everyone, and welcome to kind of our monthly video message. Hopefully this will be a new kind of fun thing that you'll be seeing. So just again, for anybody that I have not met, or it's been a little bit of time. So I'm Barb Klockner, and I'm the Wellness Director at Pro Resources. And I thought what would be fun for this month, instead of you hearing from me, lecturing you about all things health and wellness, that I'd find somebody else to do that. And so a little bit again of just the background. I've been in the fitness and wellness space for 26 years. I've seen and kind of ridden the wave through every single trend, and the up and down and every quick fix and every easy way that we all kind of search for when it comes to our health and wellness, weight loss, and all of that. So it's always been very important to me to find credible resources and professionals that I can kind of collaborate with, and then also send people to, feeling very confident. So I am so excited to introduce you to Stephanie Severson. She is the owner of Progress Weight Management here in Fargo-Moorhead. And we're going to just have a little chat about all things health, wellness, weight loss, and June happens to be Men's Health Month. And so we're going to touch on a few things men related as well. So I'm going to just turn it over. Hi, Steph, and have her introduce herself, give a little bit of her background and how she kind of landed in her own business and clinic.
Yeah. Thank you, Barb, for the introduction, and thank you, Pro. My name is Stephanie Severson. My journey to Progress was I was a registered dietitian in the Fargo-Moorhead area for 3 years. That was my first big girl job. And then I went back to school to be a physician assistant up at UND. And then I practiced in the GI and hepatology field at a big healthcare system here in town for 4 years. Working in the big healthcare system, I learned a lot, and basically I just got sick of pumping patients through every 15, 20 minutes, trying to manage inpatient care, outpatient care all at the same time, and really wanted to take more time with my patients. The thing that really pushed me to open up Progress was we treated a lot of fatty liver disease. So fatty liver disease is when excess fat gets deposited into the liver. And then if that fat is paired with inflammation, it can cause scarring and damage to the liver long term. The treatment recommendations that I was taught to give to patients was, we'll tell them to lose 7 to 10% of their body weight and send them on their way. So as a new grad, that's what I did. And then eventually I was like, I'm not helping these people. Like, I'm just telling them to go lose weight and send them on their way, but not helping with any tools, resources, etc. And so the co-owner of Progress, Cody Baxter, was doing a lot of weight management within his primary care practice. And so I started sending him referrals. And then I was like, well, if he can do it, why can't I do it? So then I was like, how do you know to do what you do? I want to know how to do that. And then I was like really the only other person that showed interest. And so I got all his information. And he was running into the same struggles as me. And so then eventually we were just like, hey, we don't really want to practice medicine the way big corporate healthcare wants us to anymore. Let's just go do this on our own. And so in 2023, in July, we opened up Progress Weight Management. I joke that if I got to pick the name, I did get to pick the name, but if I got to pick the name, it would be Progress Cardiometabolic Health. Because yes, we treat excess weight and obesity, but we treat everything that excess weight and obesity touches. So diabetes, prediabetes, high blood pressure, high cholesterol, heart disease, gout, PCOS, like you name it, anything that touches it, we're going to treat it. But nobody knows what cardiometabolic means. So hence the name weight management. But that's really how we got started.
Oh my gosh, I just love everything, every single thing about that. And I think, that, metabolic health, everybody sees that everywhere now. It's just kind of, one of those buzzwords, but nobody truly really understands kind of the scope of the meaning of that. And so, you just nailed it with just kind of that overview and, description of that. So, I mean, this is just so often, when I'm out and about working with our clients, it's never just one thing for really any of us. It's never just weight loss. Most of us have 1, 2 to 3 above and beyond, of some of those symptoms that you just kind of listed off. So I think that that's what I love about kind of diving into this conversation, is that we will look at the whole big picture of health, because if weight loss is a goal, we really do have to kind of address, a lot of those underlying things that are going on as well. So,
Yeah, we say
so I'm
frequently
gonna just,
that, oh,
go ahead.
sorry, we say frequently that you can't treat weight in a bubble. Like, you can't treat weight and not treat the other things, because the amount of blood pressure meds that I've taken away from people because they've lost weight, their blood pressure gets better. Are they coming off cholesterol meds? Are they coming off of their gout medication? Are they coming off of insulin? Like whatever it is, you can't treat weight in a bubble.
Love that. I'm going to just jump in and just kind of ask some pressing questions that have been on my mind. And again, kind of hearing your perspective. I know just in side conversations that we align just on so much. And so again, tapping into, that expert kind of brain to just kind of give your perspective. So first question is, what are the biggest health issues that you see walking into your clinic today, kind of in this day and age? What's the, primary reason that somebody would walk in?
Yeah, I would say patients struggling with excess weight and obesity, but the biggest issue being not knowing where to start, because there is so much information, misinformation. Everyone has their own opinion. Do this, don't do that. So I think that's, people just feel lost and they're like, I don't even know where to start. And that's one thing that sets us apart, is we are the opposite of cookie cutter. So we do not have a specific diet. We do not have a specific exercise plan. We don't not have a specific prescription plan. Like, we have to meet you and then we build the plan around you, because what works for you isn't going to work for me, which isn't going to work for this person over here. But also, the same plan that works for you now might not work for you in 2 years, in 5 years. You might get a new job. What if you get a divorce? Your kids are a different age. You have a big event in the family. Like, life happens. And so we're here to ride those waves with you. So I think the biggest thing is really, like, people just don't know where to start. And social media is full of, well, I lost 100 pounds doing this, you have to do this. I lost 100 pounds doing this, you have to do that. Whatever it is. And so that's the key that we rely on, is like, we have to meet you and then build the plan around you.
I just see that all the time. It's wild to think that we're in this age with more information at our fingertips, and people are more confused than they have ever been.
Yep.
And so to think that you can research anything and everything, that you want, but then, all of the different approaches, just kind of leave people kind of that analysis paralysis. They just have so much coming at them that they really do not know. And as you've said, people that are passionate about their approach or plan or diet or lifestyle, it kind of becomes a religion, to them, where that is just the echo chamber that they live in. And so then you're getting the impression that that's kind of the only way. So I love that it is, like you said, not cookie cutter, very individualized. This, kind of like jumps a little bit ahead, but I'm just thinking about, again, in all the years that I've worked with and coached people, and then just out and about with people on a daily basis, I hear this often, every single day. And, it usually is, I would say, probably age 40 plus, maybe even tip to age 35 plus, but it goes like this. I haven't changed anything, and it seems like I've put 20 to 30 pounds on overnight. What has happened? I don't know where this weight came from. I mean, can you give a little bit of insight to what worked in the 20s, even the early 30s, and all of a sudden it's not working, in the later years of life?
Yeah. So I think one of the biggest things is listening to patients and like, yes, what you're experiencing is real. It's not in your head. You're not crazy. Like giving them the time to express their frustrations, because a lot of times in the medical system, they're not listened to. They're pushed through so fast. They feel dismissed, all the things. So I think listening is key. The thing that I think contributes to it is as you're growing older, generally you gain more responsibilities. So are you getting less sleep now? Are you moving less than you used to? Are you eating more fast food, convenience food, that kind of stuff? It doesn't happen overnight and it doesn't all happen at one time. You just kind of adjust to this new normal slowly over years as more responsibilities are being piled on with work and kids. And maybe you're in that conundrum of like you're caring for your kids and your parents kind of at the same time. So you're being pulled in multiple directions. And so I really don't think it's one thing. I think it's these small compounding factors over time. And then all of a sudden it's like I woke up one day and it's like, who am I? That's a very common
That's so
theme that we
true.
get from men and
It
women in the
is.
office.
And to your point, people think nothing has changed. I'm not doing anything different. And sometimes it's that whole, you're too close to the forest to see the trees. You don't realize, like you said, all of those moving parts make a big impact. And closing out kind of the end of May, which was Mental Health Awareness Month, I think we just don't realize the impact that all the stress, can affect our mental health, which then tips into our physical health, and they're just so interconnected. And we up north Midwesterners, believe the more stress that we can carry, the hardier we are and the, stronger that we are. And so just kind of that whole cycle too of, do you kind of address stress and mental health, like coping, when you are working with your patients?
Yeah, so we have what we call the 5 pillars. So we will go over like your past medical history, prior weight loss things that you've tried, diets that you've tried, health events that you've had, whatever. But then we will address your nutrition, your physical activity, your sleep, your mental health, and then talk about medication optimization. Different patients put different amounts of effort or support into each bucket. So maybe one patient, we're really talking about nutrition. Maybe another patient is really focused on sleep, because if your sleep is terrible, nothing else goes well. So, maybe I've had patients who come in here and they're like, I really want to lose weight, but their depression and anxiety is so out of control that we switch gears and we're like, we really need to focus on your mental health first. Otherwise, we're just climbing this uphill battle and we're not going to go anywhere. So we really need to focus on this before making those other things better.
Amazing. Just love that. When I, kind of talk about May being Mental Health Awareness Month, and then June, launches us into Men's Health Awareness Month. And so if you're a man, listen up. And if you love or know a man, take in this kind of information as well, because one of the things in the world that I live in, when I'm out talking health and wellness, a lot of times it's talking about healthy eating and getting activity and good sleep and, managing our stress. But the bottom line is statistics show that men, you're really not great about getting to the doctor and doing your annual assessments, your physical kind of that baseline, blood work and those screenings. And I always kind of describe it as kind of the iceberg syndrome, where I do believe a lot of men feel good. And so then they just think they are good. And really, that's above the iceberg. What's below the surface could be all kinds of things that are brewing that could cause more catastrophic kind of events down the road. And so what would be kind of your message about the importance of doing some preventative work and screening to all of our beloved men out there?
Yeah, so I would say, I mean, I'm stubborn, but men are just stubborn in general. And so a lot of times we'll end up seeing like the girlfriend, fiance, the wife, and then the husband begrudgingly comes in later and we will see
Yes.
them. But I mean, the
Mhm.
advice I would give is you need to look under the engine. Like, what's your cholesterol? What are your liver function tests? What's your glucose level? What's your kidney function look like? Do we need to check testosterone? Like, we need to look at some of those things because again, a lot of those things don't happen overnight and you just become accustomed to your new normal. So you get a little more fatigued, you get a little less energy, and it's not happening overnight, but you're like, wow, I wish I felt like I was 30 again or whatever it is. And so knowing that stuff ahead of time can really prevent you from going through a lot of those sluggish years. And a lot of things like heart disease, liver disease, they don't cause a lot of symptoms until they do, until they cause a heart attack, until they cause liver failure. So there's not really a lot of symptoms unless we're looking under the hood to see what is wrong. One example that I like to use with men is when it comes to cardiovascular disease, we'll be talking about like, hey, we should get, we should looking at a little bit of weight loss. Can we get you moving and exercising a little bit more? Your sleep is terrible. And I'm like, if you don't do those things, you're at this percentage risk of a heart attack. They don't really care. You're at this percentage risk of a stroke. They don't really care. Well, do you know what also has blood vessels in it? Their penis. So erectile
Yeah.
dysfunction can be
And
caused.
everybody in the room sat up
Yes. So erectile
and is now
dysfunction
paying attention.
is a check engine light when it comes to heart disease, stroke, etc. Because the blood vessels that are in a penis are smaller than what's in your heart, etc. So those are going to get blocked first and cause problems, typically with erectile dysfunction. And then a heart attack, if left untreated, you're going to have a heart attack in 5 to 7 years. You threaten a
Wild.
man's penis, and all of a sudden they'll do all the things that you want them to do.
No,
Um,
that's my new angle.
But it's true. Like
Mhm.
it's truly
Yeah.
cardiometabolic care. And like we ask about erectile dysfunction because nobody's going to openly admit it. But if that is something that a man is struggling with, that's a check engine light to say, hey, something's probably going on in your heart. Something's probably going on in your brain blood vessel. Like we need to figure out what's going
Mhm.
on.
And I love that so much because, when we talk health, wellness, fitness, people kind of, will attach to aesthetics being the motivating factor, but I am so deeply passionate about quality of life and not just surviving every day, that we're moving to thriving. And when some of that starts to impact our life, that is not allowing us to live a full, rich, you know, life
Mhm.
that we all, hope to be kind of thriving in. And so, just so much more than exercising and eating right. I mean, it's just about, these kind of later years in life that we're prepping. I
Yeah.
I talk so often about, we work our life away and lose our health to get to those years of life that we hopefully, can enjoy. And then because we have not done the work that it takes, or we've ignored, some of those appointments that we should be going to, now all of a sudden, some of those issues have caught up with us. So can you give any examples of clients that you've worked with where you've seen them almost grow younger,
Mhm.
through starting to get healthy, losing weight, and maybe they came in with the idea of, well, I'm this age, there's probably not much hope for me. And
Yeah.
then all of a sudden you start to watch them,
Yep.
you know.
Yes. Lots of stories. So we call them non-scale victories. So we really want to
Awesome.
focus on taking the emphasis off the number on the scale. Like most people walk into our door because they want to lose weight, but the weight, I don't want weight to define people. Like those three numbers should not define who you are.
Yeah.
And so taking the
Mhm.
emphasis off the number on the scale and focusing on those non-scale victories. So some of my favorites are, I have a patient who is now going to a gym with her granddaughter. And they go together and they're lifting weights, they're doing squats, they're doing planks. You know, so that's one of my favorite stories. One of my
Awesome.
favorite non-scale victories is I have a female patient who could not watch her grandkids because if they were to run away or across the street or something, she's like, I can't move fast enough to keep them out of harm's way. And so she came to me, we worked on weight loss, she started a lifting program, she's eating her protein, doing all the things. She's down about 80 pounds and now she watches her grandkids 3 days a week because she can keep up with them. She's wrestling with them on the floor. She can do all the things. And so like I get goosebumps just talking about it, but
Yeah,
like
I know. I love it.
that's why I do what I do is
Mhm.
because I want people to have that quality of life and it has nothing to do with the number on the scale.
Absolutely. So now kind of launching into, the next topic, which of course is probably one of the hottest and most confusing topics that's kind of out there right now, which is, the medications for weight loss. And kind of watching, the focus a lot of people have does go back to the scale. They start thinking about losing weight and then we all have that number in mind, that we want to be again. And I know that, that, some people get just really frustrated, not necessarily understanding the full picture of, that these are disease management medications. And there's a whole kind of process as to how, you start somebody on a GLP-1. But can you just talk about the full picture of the medications, who would be good candidates for it, and who are not necessarily great candidates for?
Yeah, so I will start with one that the medications are a support tool. And that is something that I stress a lot. So medications do not replace nutrition. They do not replace physical activity, sleep, mental health, those other pillars that I talked about. They are a support tool to support those other lifestyle factors. And so when we're prescribing a medication, you do not come in, we prescribe your med, you walk out the door. Like we're still
Mhm.
talking about all the lifestyle things. So that's the biggest thing that I like to talk about. The world of GLP-1s really took off in 2018 when Ozempic came out. But anti-obesity medications or weight loss medications have been around for like 40 years. They've all been, mostly oral up until the GLP-1s really came about. But now, once we had a once weekly GLP-1, we've seen the use and prescription rate of them basically skyrocket. And so when they first came out, they were really looking at treating type 2 diabetes and looking at, insulin resistance and bringing that number down. And then in those trials, they were like, wow, these are great for type 2 diabetes and blood sugar levels. People are also losing weight. So then they started to study it for obesity. Why they work so well is how I explain it to patients is they're working in the brain on reducing appetite and reducing what I call food noise. So if you guys have never heard of food noise before, it's the constant chatter, the constant pull, the constant thinking about food, like eating breakfast and thinking about what you're going to eat for lunch, sitting in a meeting where there's food and you can't even listen to what's going on in the meeting. You're just focused on the food that's right in front of you. So that constant thinking, it quiets that food noise. They also work in the stomach on delaying how fast food leaves the stomach. So you're going to feel fuller faster, you're going to feel fuller longer, which is going to decrease the portion size that you're able to eat. Then they're also working in the background on insulin resistance. So insulin is released to help keep us from getting diabetes, but the more insulin that's produced is likely driving our weight up. And so even if you don't have pre-diabetes, diabetes, if your insulin levels are high, it's driving your weight up and it's making it really, really hard to lose weight because you're fighting against basically a hormone that's promoting your weight to go up. So the GLP-1 medications are working in the background to help that process work more efficiently. That's really how they play the biggest role into weight loss and the treatment of obesity. Now, who would be a candidate? The FDA approval is a BMI over 30, which I don't love BMI, and we have body comp scan. I won't jump on that soapbox right now, but
Mhm.
fat mass and muscle mass are much more important than BMI, but the rules
Yeah.
are the rules. So
Mhm.
BMI over 30 or a BMI over 27 with a comorbidity.
Mhm.
Now, we see so many positive effects with these medications that would be considered off-label. So they're not FDA approved for some of these reasons. They're being studied for a lot of these reasons, but we just see them improve in lots of places. Other FDA approvals, obstructive sleep apnea. So we see those levels get better. In the sleep apnea trials, they actually looked at the amount of tongue fat that people had, pre-Zepbound use and post-Zepbound use, and the amount of tongue fat, like how that went down in treated sleep apnea.
Seriously.
Crazy, yes, love it.
Yeah. It's
I
wild.
mentioned liver disease earlier, but MASH, or metabolic associated steatohepatitis, basically scarring of the liver, they're approved for that. They are phenomenal drugs for PCOS, which is now renamed like last week to PMOS. But if you know somebody or if you have PCOS, these medications are amazing for that. It's called the Ozempic baby boom for a reason when the meds came out.
Wow.
Being
Yeah.
studied for osteoarthritis, being studied for chronic low back pain, being studied for alcohol use disorder, smoking cessation. Like there's
Yeah.
a lot of studies now coming out on, like, we're seeing reduced risks of cancer in patients that are taking GLP-1s, improvement in autoimmune diseases because we're reducing inflammation. So literally the list is endless. And so that's where it's like, yes, we can use it on label, but sometimes we're using them off label.
Got
Just
it.
because they don't have an approved FDA indication doesn't mean that we can't use them. Now, I think something that's unique to us is we are experts in managing it, because there are a variety of GLP-1 options. There are a variety of doses, and just because there's a higher dose doesn't mean that you need a higher dose.
Awesome.
Because it's that balance of, I want to suppress your appetite and your food noise to where you feel like you're in control again, but I still need you to have some appetite, because you need to get your nutrition, your protein, your fiber. So it's a balancing act.
Amazing. I think too, just, kind of listening to you give that rundown, once again, if somebody has an addiction, with smoking, sugar, alcohol, whatever it is, and I mean, but then they're trying to take big steps, in their nutrition or fitness, that's just really going to be an uphill battle, if they're not kind of addressing, and we all know how difficult it is to kind of step away from some of that addictive pattern and that cycle too. So, again, I think it just shows how absolutely hand in hand it all goes. And everybody can have their opinion, whether they're, think the medications are pro or con. I mean, it's just something that every single individual should, kind of step into, on their own and figure out for themselves. So, and I know I could talk to you for 2 more hours at least, and hopefully we will, kind of have like a series that will begin here, and we're just kind of trying to stay a little bit more focused in our discussion today. And we've got just a couple of minutes to kind of wrap up. And so I think, this is always interesting to me. If you could think of like 1 or 2 simple habits, and to kind of lead into that, when I'm out coaching, I'm often referring to the theory of the atomic habits by James Clear. He talks about kind of honing in on 1 or 2 habits at a time and really becoming kind of consistent and like an expert in those areas. Because I think when it comes to health and wellness, a lot of us think if we can't do it all, what's the point of doing any of it? And so if you could think of 1 or 2 things that people could start today and just get really consistent with those 1 or 2 areas that you see making a big impact with your patients, any
Yeah.
input on that?
So my 2 would be move after you eat.
Ooh, awesome.
So many of us eat and sit. We
Yep.
eat and get in the car, we eat and work, we eat and watch TV, whatever it is. But if you eat and sit, your muscles are your biggest source of taking up all the sugar you just ate. If you sit, your muscles aren't active, so all of that is going to get stored as fat. If you eat and move, your muscles are now moving and going to burn up that sugar that you consumed. So that would be, it doesn't have to be a workout. Eat and do some chores around the house. Go outside and do some yard work. Do a quick walk around the block. Like, it doesn't have to be like, oh, I'm doing a 45-minute workout. Just eat and then move.
Awesome.
So that would be one. My
Amazing.
second would be sleep consistency. Go to bed at the same time, wake up at the same time. Like, I know that sounds so boring, but the boring
Mhm.
things are what work. So those are my 2
Yes, I love
priorities.
it. I say it all the time. It's the boring basics,
Yes.
coming back to the boring basics and becoming. And what I love about your 2 tips, it wasn't eat 10 servings of vegetables a day. I mean, just really simple habits that give us the whole picture of wellness, not just, kind of the get to the gym and eat this, healthy, perfect diet. So, with all of this being said, I'm just so grateful for your time today. So again, Steph Severson at Progress Weight Management, located right here in Fargo. We hope that we get to have another conversation again very, very soon. And thank you so much for your time today.
Yes. Thank you, Barb.
Talk again soon.
Bye-bye.